talk to you afterwards. Good evening, everyone. My name is Jerome Evans, and I am one of the co-chairs of the Public Health Advisory Committee. I'd also like to introduce our other co-chair, Laura Rangard. Would you like to wave, Laura? There she is. Thank you. Before we begin, I'd like to note that this meeting includes the remote participation of members as authorized under Minnesota statutes section 13D.021 due to the declared local health pandemic. I will now call this meeting to order and ask Hattie to call the roll so we may verify the presence of a quorum.
Okay, Terry Ann Jones.
Here.
And KJ is not with us tonight, I don't think. Mary Pikes is my throat tonight.
Present.
Kozar Mohammed. Lisa Nicotra.
Here.
Anna Arkin.
Present.
Excuse me. Tima Jaffer.
Here.
Lucia Jackson.
Present.
Laura Rangard. I see you. I just didn't hear you. Okay.
Sorry, present.
Jerome Evans.
Here.
Andrew Crook. Andrew. Brett Culp.
Say, did you say
What?
Brett? Did you say Brett?
Yeah.
Oh, yeah, present.
Wanda Felder.
Present.
Meredith Martinez.
I'm here.
Craig Hedberg.
Here.
Babette Appland.
Present.
Erin Hurley is not with us tonight. And then Jolie Punjabi. Okay, so we have 13 members tonight, so we have a quorum.
Thank you, Hattie. The part I was alluding to before we started reading the roll was the remote participation as authorized under the statute due to the declared local health pandemic. And since our last meeting, I believe at least the governor's emergency order has been rescinded. And so I wasn't sure if we were still authorized to meet remotely, but we're going to do that today. And I'm seeing some nodding heads. So that's wonderful. Next, we're going to move into discussion of the minutes and the agenda. So regarding the minutes, were there any questions from last month's minutes? Any discussion? Okay, as a reminder, you can use the hand raise reaction or wave your arms or unmute yourself and speak up whenever you have something to contribute. We are going to do a roll call vote on authorizing the minutes and approving the agenda at the same time. So seeing no discussion, Patty, will you please go for it? You are muted, Hattie.
Thank you. Terry Ann Jones.
Approve.
Mary Pike.
Approve.
Kozar, are you with us yet? Lisa Nicotra.
Approve.
Anna Arkin.
Yay.
Tima Jaffer.
Approve.
Lucia Jackson.
Yay.
Laura Rangard.
Yay.
Jerome Evans.
Yay.
Andrew Crook. Britt Culp.
Yay.
Wanda Felder.
Yay.
Meredith Martinez.
Yay.
Craig Hedberg.
Yay.
Babette Appland.
Approve.
Erin's not here. And Jolie, are you with us yet?
I
Okay.
think she sent an email saying she wasn't going to make it to the meeting.
Okay. So that's been approved and the agenda's carried.
Awesome. Thank you, Hattie. So the first item on the agenda is our priorities survey. So I've never shared on this before. Hattie, do you share the presentation? For Teams, or
You
do I get to do
can.
it myself?
Do you have it up, or maybe Margaret can bring it up?
Yeah, I can do it.
Okay, so if you'll remember, members, a couple of months ago, we did this thing where we broke up into subcommittees. And then we identified priorities, and then we shared what those priorities were with each other. Since then, another subcommittee, almost a subcommittee of the subcommittees, met 3 times to discuss the creation of a priorities survey. And if we get Sharon, oh, not yet. Well, you can open the attachment. It came with the email that Margaret sent to you.
Yeah,
earlier today.
I'm almost there.
No stress. It was on the spot.
For whatever reason, it was the spinning wheel of death.
Oh, I gotcha.
Oh, wait a minute, come on. I'm getting there.
No worries. Hey, there we go.
Woohoo!
Thanks, Margaret.
You betcha.
So let's go to the second slide, please. So the point of the survey is to help us prioritize our work. We identified those priorities. Craig, Lisa, and I got together. And what my hope is at the end of the survey, we'll know exactly what priorities the committee as a whole is ready to take action on. If you'll recall, during the time when we split into subcommittees, there were a lot of questions about, well, you know, this concern I have is actually in this other subcommittee, and how are we going to work together? There are intersections, Jerome. A lot of people email to let me know about intersections. But hopefully, we will be able to address all of those concerns through this survey. Okay, next slide, please. We are also, hopefully, going to get information on items that the committee views as priorities, but that we need more information on. Things that we know are important that we don't feel educated enough about in order to take direct action on. Next slide, please. So we divided the survey in what I hope is a pretty intuitive way. It'll be by those 3 subcommittees that we'll review very quickly in just a second. And let's go on to the next one, and we'll just very quickly dive in, because I know it's been a couple of months since we talked about it. One of those subject matters was food, drink, and medicine, including access to food and water, intentional and unintentional drug abuse, vaccination concerns, which I predict will be a popular topic on the survey. Next one, please. Environmental concerns and mental health concerns. A lot of the intersection conversation I had to do with mental health. That includes climate change, air quality. I don't know, this week was really rough for air quality, or maybe last week. And including safety, speed limits, biker safety, domestic violence. Next slide, please. And then racism as a public health crisis, including disparities in health outcomes from various sources, and recommendations regarding structural changes needed at the intersection of racism and public health. Okay, next one. So this is, one second, message from Britt. It popped up very quickly. I've got like 8 different things up, but it was a terms question. Britt, do you want to pop in and just issue that clarification?
Yeah, so in the substance use disorder field in which I work, we've been getting away from the terms of substance abuse or drug abuse, just because there are more stigmatized connotations with it, where it kind of carries this idea where there is more intentionality versus it's part of the process of addiction. So just like in other drafts, if it could just be like substance use, because not everything is abuse or misuse, it's just use.
Thank you very much. So that language is repeated in the survey. And depending on how things go, I might be able to pop in and address the language before the email goes out. I'll try that. Okay. The rationale of the survey responses we touched on, but this is what they're going to look like. You're going to have 4 options you can select from. One is that you have an action in mind that the committee can take on the priority. So if you know that we can convene a panel, if you know of some speakers you'd like to hear from, if you know of recommendations that you believe the committee can make, then that would be the appropriate box to check. I can conceive of the committee taking an action on this priority. So you might not know exactly what speaker, but you know that if we had a speaker come in, they might be able to steer us in a direction towards action. Then I need more information on this priority, and this item should not be a priority for the committee. I feel like those are both self-explanatory, but if you need more clarification, chime in. Next slide, please. So these are, I went over this very briefly a second ago. These are examples of what actions look like. I think we anticipated that the response, I have an action in mind, is like the exciting one that you want to do, but we still worry that people don't necessarily have a full grasp of the actions that we're empowered to take as a committee. And so these are 3 very popular actions that we do take: writing a letter of support, issuing recommendations, or convening a panel for discussion and education. And then, next slide, please. Of course, we do leave the opportunity to share additional information. And those are, I think those are, this is almost word for word. What did we miss? What additional information would you like to share? And are there other priorities that we should pursue that are not listed on the survey? Then, next slide. These are examples of what additional information might be. High level or detailed information on how the committee might take action. So if you selected that you would want to take action and you don't want to engage in follow-up emails, you can just leave that action down there at the bottom of the survey. We can follow through that way. The thoughts on priorities that intersect, sometimes you want to share. And then thoughts on great resources pertaining to a priority that the committee should review. Okay. Now, I know that's a lot for me. We're going to go through the list of priorities, and my subcommittee co-members are going to take on 2 of the 3 subject matter questions. Oh, and maybe I can spend this time, Britt, updating that language. So I don't recall. Is it Craig or Lisa that's going to take on this next one?
Lisa.
This is mine. So we can go to the next slide. We discussed in our subgroup issues relating to opioids. KJ Starr was particularly passionate about this one, how you know, the opioid crisis and the pandemic seem to maybe fade away from the headlines, but it didn't fade away in reality. And if anything, now I think we're finding out that things actually got worse. She particularly, as it relates to Minneapolis, has noted some disturbing things in her own neighborhood with opioid problems. Next slide. Yeah, and maybe we don't know which drugs that are and aren't opioids, but again, I guess it's under the heading of substances that aren't necessarily good for you or society. Next slide. We talked about loneliness. This is one that I brought up in the very beginning, and this is one that definitely intersects with mental health in the other category, and how loneliness is at the maybe a root cause of a lot of things, anxiety, depression, addictions, and you know, undesirable behaviors in society. And it seems to be also pertinent in that our current Surgeon General of the United States has written a book about it, And when he was sort of doing his own sort of listening survey across the country before the pandemic, found that loneliness was indeed a big concern amongst Americans all across the country as a public health issue. Next slide. Again, I just sort of went over this, that it can be either root cause or at coinciding with or a partner of these other things, mental health and drug use. Vaccine hesitancy, obviously front and center. Right now, with we're sort of in an inflection point in the country with half the nation being fully vaccinated, half the nation not. I actually just learned something today in the paper that was sort of distilled it for me. We sort of view vaccine hesitancy as a consequence of being a conservative phenomenon. But they've actually shown that vaccine hesitancy happens, I'm going to read this directly from the New York Times, across the political and cultural spectrum in the United States for a variety of reasons, and no single argument can address all these concerns. Changing minds is often a slow, individualized process. So again, in our little subcommittee, we've been kind of emailing back and forth current articles about vaccine hesitancy. Next slide. And just what tools will work for people to get a vaccine despite their concerns. It's going to vary, again, with different people, different demographics. Next slide. Access to dentistry. I don't know that we specifically covered this one, but again, in this climate of limited resources for certain populations, access to dentistry can be a concern. Next slide. Healthcare service access aside from dentistry. Again, is this a concern in our population here in Minneapolis? Next slide. Don't know. And I think that's it. I guess I can comment a little bit about the mental health stuff in the next one, but I think this is now Craig.
Sure, thank you.
Yeah.
I would like to say, first of all, that working with Lisa and Jerome was really fun. And this was a great exercise, and I really enjoyed the opportunities to spend some time with them. But so we, environment and mental health priorities covers a lot of different ground. And I think that as we work through the next few slides, you'll see that we put a lot of emphasis on the mental health dimensions of problems, largely because of the need in the community. And I think they lack visibility compared to a lot of the environmental problems that are relatively more widely talked about. And some of the environmental issues have naturally larger advocacy groups. So, things are going to be happening whether, we're pushing that or not. So for a variety of reasons, the focus of our subgroup was really on mental health issues. If I could have the next slide. One of the key ones was a lack of mental health service providers for young people. That across the community, we have significant mental health issues involving young people, and they don't always have access to providers. And that's partly a manifestation of the way medical care provision is set up, and the way that mental health and medical care have really been treated differently across our systems. And it's actually quite interesting to me watching the Olympics and seeing the prominence that mental health as an issue is getting, and the importance of mental health and providing support for mental health is. If I could get the next slide. Along with that is a lack of culturally competent mental health service providers. So, we have issues of access, and then issues of access for people who are really trained and know how to deal with some of the cultural subgroups of the community that may have the greatest amount of need. Go to the next slide. And then sexual exploitation prevention, which is, again, as a cross-cutting issue, is tied in with mental health. It's tied in with substance abuse. It's tied in some of the other issues that we've been talking about here. And then the next slide, public safety, which is a very broad topic, that includes issues of violence. It includes issues of policing that I know is at the forefront of the city, and is a ballot issue on the upcoming elections, and the multiple dimensions of public safety and what role we as the PHC can play in that, I think is tremendously important. In terms of access to guns and violence prevention, I think there's a lot for the public health community to be very engaged in. And then I'll go to the last one on this set of our environmental and mental health is air quality. And air quality is an important issue because it is, something which the city, the quality of air in the city is something that is a concern to everybody. But we also know that there are a lot of localized air quality issues that are disproportionately affecting some areas of the city that also are subject to other stressors as well. And, that's something that I think would be worth spending some time with. There's not a lot we can do when it's 100 degrees and there's 98% relative humidity, and Canada forest fires are burning. There's not a lot we can do with that, but there are a lot of localized effects that also warrant some focused activity. And I'll turn that back then to Jerome for the next slide.
Thank you, Craig. And I will echo your comments. It was a pleasure working with both you and Lisa. So racism as a public health crisis. The next slide, please. You'll recall shortly after the murder of George Floyd, the city declared racism to be a public health crisis. And the committee has made it a priority to follow up with our council members and with the city at large. My next slider has just walked away. To make sure that we know what that means. What does it mean that it's a crisis? When is the crisis over? What actions are we able to take? So that will be, I look forward to the responses to that question. Next slide, please. Systemic racism in the healthcare system in general. Now, I personally don't have a lot of experience with the healthcare system, but it is widely shared that within the system, there is a very big issue of systemic racism. So that is one where I would take that I need more information on, but I look forward to taking action on it. And then I see that some slides have duplicated, Margaret. So I think you might have to hit next slide. Oh, perfect. Systemic racism leading to issues of access to care. So how does racism keep people from getting the care that they need? Next slide, please. Maybe the next one. This slide's duplicated. It wasn't, you did click, Margaret. You did, it was good. It was a solid click. Implicit bias in healthcare. This is interesting. I host a podcast. I don't know if I've told you this story. I host a podcast, and one of my guests, who is a caregiver for her mother, spoke to how she had to make sure that she got her mother's hair just right before going to the hospital or going to the doctor, because she was certain that her mother would receive lower quality hair based on how the doctor perceived her. So that was an interesting example that I can draw from. Next slide, please. Culturally competent care in Minneapolis. Next slide, please. Sourcing and organizing data on racial disparities. We talk a lot about our knowledge of disparities. I have not yet seen a central resource that really brings all the data together. So I thought that was a really interesting priority. Next slide or two, please. And then leveraging the data that we do have to reduce disparities vis-a-vis the social determinants of health. So we do have access to some data, we do have access to some resources. How can we start using that data that we do have in order to affect change? And then one last slide, at least on the issues. Criminal justice reform. That will be a big priority, but we do have other committees around the city that we can leverage when addressing criminal justice reform. Okay, Margaret, next slide. Final questions. I know I've seen that the chat has been lively. I haven't been able to open it. So if anyone wants to unmute and share pertinent thoughts from the chat, that would be welcome.
I can unmute because I believe, and Hattie might be able to actually answer this, I believe the chat needs to be reserved for not general comments because not everyone can see it, but for like 1 word or 2 word things that say like, I have a motion, I would like to raise my hand, I have a question, I approve, you know, or something like that. So because not everyone has access to the chat, so not everyone can see it. And because it is a public meeting, we are required by the city clerk and the open meeting laws to make sure that whatever conversation is going on can be both recorded as well as heard by folks that are attending the meeting. So I would just encourage you that if you have comments, this is a perfect place to be able to voice your comments. Let's hear your voice and hear your words because it is some really good stuff. So I'm going to read what was going on there. Let's see, we already addressed the drug use and substance use thing. DHS just revamped their repayment of dental service reimbursement rates for Medicaid by 98%, nearly doubling the rate. It had not increased in nearly 30 years. And actually, Alicia, that is fantastic to hear because, or it's Alicia, I believe, because a few years ago, the PHAC actually had a couple of great presentations on dental care, dental access, children's dental services presented, as well as another organization. And that is exactly what they talked about, that the reimbursement rates were so low that it was just, yeah, like a public health crisis, you know, for dentistry and for dental care. The other comment was, unfortunately, for folks who have an income that puts them above the Medicaid threshold, it's still challenging as dental insurance only pays for a certain amount each year, which doesn't match the cost of services. Which I think what you're saying there, Britt, is that it also means that people are responsible for the rest of the payment for what is not covered by dental insurance.
Right. Usually like with dental plans that I've been able to access through employers, it's a $2,000 cap. And if you have cavity or need a root canal or anything else, like as we get older, especially, that tends to pile up. And I remember having to take out a line of credit just to pay for something for dental, even with insurance.
Most definitely. There was another comment that said, hopefully more dentists will start seeing MA enrolled children, especially the very young. And then another comment, indeed, it is hard all around in the dental space, but I'm hoping the increase in reimbursements rates will start to prompt payers and providers to shift their thinking about dental access. And then Britt added, they avoid it due to trauma from experiences in medical racism and provider bias. It's true, the bias is real. I see it daily. And someone just identified as unknown user said, me too.
That was Laura Rangard.
Yeah.
Oh, thank you. Thank you.
Yeah.
Yeah, I'm reading them on my phone since I can't see them on my screen.
Oh, you can stop sharing now.
Oh, is that it? Are we done?
That's it. I
Oh,
think there's like
fantastic.
thank you. It's good. So
I thought the slide that said final questions meant that there were like a couple more questions coming up that were on the survey that maybe didn't relate to other things.
no, there were already way too many slides there. So don't worry. Thank you very much. So while Margaret was reading content from the chat, I went ahead and I emailed that survey out to the committee. And so what we're going to do is take maybe 8 minutes for you. If you want, you can fill out the survey now. Otherwise, you can take a stretch break or attend to human needs. And then let's come back at 7:32, 6:42, 8 minutes, and then we'll reconvene. Okay? Break. Happy surveying.
Jerome, the survey got blocked because at my work email somehow.
Oh, that's okay. Are you able to forward it to your personal email?
Yeah.
Okay.
I was just wondering if you're sending me a virus.
Not intentionally. That's funny. As soon as I got up, I said I should have asked for questions or to make sure everyone got it who wanted it. This is good. I've only gotten the one email about problems with the survey. So I'm like, yes.
And I see that Kozar has joined us. Kozar, we are taking a few minutes to respond to the link that Jerome had emailed out that contained the priorities survey.
Yeah, I just completed it.
Oh,
Right.
perfect. Yeah, I just wanted to let you know if you haven't, go ahead and do it.
Yeah, I just finished not long ago. Thank you.
Yeah, we will reconvene in about 3 minutes. Oh,
All right.
about 2 minutes, sorry. How about whenever Jerome tells us we reconvene?
Now, let's call this the 2-minute warning. No stress if you are not able to complete the survey now. We will not review the results immediately, so no worries. If you've already finished and need something to do, you can pull up the draft guidelines, the lead elimination action plan that Margaret shared with us. Okay, 1 more minute. And that's not to hurry anyone, that's just to keep us on schedule. Okay, so I am assuming that we're all back and that no one had any significant trouble getting to the survey that wasn't addressed during the break. But you know what they say about people who make assumptions, so let me just ask and make sure. If you had any trouble with the survey, please raise your hand or unmute and let me know, or send a quick email and I can address that after the meeting. There is no shame in a bad Google form link. Okay, seeing that I haven't looked at the results yet, so I'm very excited after the meeting. Yes.
Jerome, it's Mary Pike. I lost sound for a minute and I have not been, I didn't do.
Oh, okay, Mary. I don't think you lost sound. I think we took like a 7-minute break.
Hearing about every.
Okay, yeah, you're breaking up on our end as well, Mary. Yeah, she's having connection issues. Mary, I'm gonna, if you can hear me, this seems worthy of chat, right? Margaret, will you let Mary know that I'm gonna circle back to her after the meeting and fill her in on this survey?
I did hear that. Thank you.
Okay, great. It's like the clerk can't get mad if we chat that, right? Just watch. The next item on the agenda has to do with the lead elimination action plan. So when Laura, Margaret, and I were meeting about the agenda for this meeting, we realized that there was really no time for discussion on the plan that Lisa Smedstad had presented to the committee last month. And in fact, the plan really goes well beyond the recommendations that the committee issued to council or sent to council. And we wanted to just kind of go around in that now hopefully familiar style of asking questions. And Margaret, do you happen to remember what those 3 questions were? It's like, what, something about the ward? I remember I put you on the spot with these 3 questions last time too.
Yeah, no worries. So the 3 questions were in, like when you reviewed the childhood lead poisoning report or the plan, what are 1 or 2 highlights that you see in the report? What are 1 or 2 connections between the information in the report and PHAC committee action, which kind of goes right along with our priorities survey, but this is on actions that obviously as a committee PHAC had taken a while ago. But what are those connections? Is that it's like, hey, we could help amplify this message. Hey, we could get information out. We could create a 1-pager, whatever. And then if there was anything that was missed, like from your perspective, was there something that seemed, like a glaring gap, or that you just felt needed more attention and maybe it wasn't drawn out in the plan? Not sure that the plan necessarily would change, but I know that Lisa would be interested in that kind of feedback. So those were the 3 things: 1 or 2 highlights that you see, 1 or 2 connections for committee action, and if there was anything missed.
Awesome. Okay, so heads up, my participants list goes in alphabetical order by first name. And so that's the way we're going to go around and ask people if anything jumps out at them. If you want to pass, passing is just fine. If you need us to reread the question, we will reread the question, okay? Awesome. I can see the people who are very familiar with this order are already coming back onto video. Alicia and Britt. Anna, heads up, you are actually on that list too. But Alicia, you are first. Were there any highlights in the plan that jumped out at you? Did you happen to note any committee actions or connections that we can make? And did you happen to catch anything that the plan may have missed?
I don't think it's a bad idea. My initial struggle in general with this entire plan is that I don't really know how strongly we're going to be able to reach all the homes that are truly old. That's my main focus. And then rental apartment buildings too. I think it will be, at the end of the day, a very hard sell in the sense if you're approaching some of the older apartment building managers and staff and saying, hi, we're the city of Minneapolis, or we're PHAC, and we're potentially concerned that you have lead in your water and that you should redo your entire pipe system. And they'll say, I'm private property. Why are you here? Which, is it as a business interest, that's my main concern. I would, of course, want to fight for and strive for the people who are living in those sorts of facilities and buildings, because I am one of them. My apartment building was, I'm pretty sure, built in the 70s, and I'm still here hanging out. So yeah, I think that's all I'll say for now. I would think it would be great if there was something that we could do regarding older apartment buildings. I don't know if there's anything that we can do in particular regarding Section 8 or, assisted living housings, but those would be my main points of focus. Thank you.
Oh, thank you. You really, in that phrase, points of focus, I think the plan is very narrowly tailored to certain, I want to say, zip codes and parts of the city, but the problem is much bigger than the plan. And you are spot on with that tension between public health and private property and trying to get people to do what we think is the right thing with their money. Great. Anna, are you here, and would you like me to repeat those questions?
Yeah, I'm here, and no, you don't need to repeat them. Along the lines of what you were just saying, Jerome, I think the plan has a lot of steps in the right direction and covers a lot of good areas, from in-home hazards to things like consumer products. But it's a huge issue. And so, again, steps in the right direction, but with what Alicia was saying, what else can we do to protect people who rent, especially, and are usually not in a position to, they're not going to make the improvements on their own because they tend to be really costly. I didn't go back and look, but I'm curious if there's the idea of generating a list of people who are certified, who have the lead safe certification, I think from EPA, to do painting and other remodeling. Because from personal experience, it's really hard to find people who are certified in lead safe work.
I'm taking notes. My notes are never as good as Margaret's, and I know she's taking notes too. But I'm trying to take some notes as well. Thank you very much, Anna. Oh, Babette. Oh, something. Okay, just heads up. Things in my participation list changed a little bit. Okay, Babette, you're surprised. You're up.
Hi. Yeah, well, I'm actually impressed with the scope and depth of this, and given that the issue of lead poisoning was focused on in the I think infrastructure plan, I'm hoping that the funding and the will be there to actually implement it. I was pleased to see that there are grants and loans that will be made available, and I think key is going to be monitoring and enforcement.
And enforcement. Okay, Britt, you are up.
All right. So some of the things brought up where it is, trying to have that public health with these independent landlords. And when you're targeting the specific zip codes, you have kind of that greater abundance of the slumlord. And we don't always have landlords that actually live locally. They live in other states, and people rent out and pay the rent and all that. And they're, it's already hard enough to get into housing for a lot of people, and they're kind of stuck with these slumlords. But if they have to take on any cost via enforcement, how is that going to translate to the tenants in maintaining the affordability of that housing? And would there be, I was reading through it when I could today. It was kind of it's been a hectic week. Are there opportunities for grants to take care of this, or forgivable loans where it's like we loan the money out, but they need to demonstrate that they used it for these purposes and no costs were passed on to these low income, largely BIPOC renters to have that loan forgiven?
Great call out. It is certainly not the intention of the plan to make life harder for the tenants living in these properties, but sometimes these things happen.
There's a lot of sneaky landlords out there that any extra costs that they incur, even just with like property taxes, or if they have to replace something in the building because it's old, or just for kicks and giggles, they just jack the rent up. I mean, we just look at the prices for housing in and of itself right now.
Very, very good call out. Thank you for keeping it real for us. Taking it from the paper to actual application, what that could mean for people's lives. Just to give some people a little heads up, I'm seeing Craig, then Fatima, and then Lisa. And again, those questions are highlights in the plan, committee actions or connections that you saw when reading the plan, and things we might have missed. Go for it, Craig.
Yeah, well, I think we've been discussing this plan and the background of the plan for quite a long time. So I think it's really great. There's a lot of good analysis. I think there could be a little bit more. I think the idea that reducing blood poisoning is a public good is one that, again, raises this issue of sort of a public good versus a private cost to remedy the situation. So it does squarely argue for public investment to deal with that. But as Britt argued, the issue of the owners is problematic to the extent that there's differing levels of motivation among the owners, and so it's a lot like we deal with these issues in sort of the food world, the food safety versus food access, and so here we have a housing safety versus housing access. And at a certain point, if housing isn't safe, then we don't have access to housing. And so I think one of the things that could be added, maybe as an addendum, would be some type of an analysis of what the cost of lead poisoning is, both in human and financial terms. And that, that as we follow those trajectories, that reducing the burden of lead poisoning, those are benefits, tangible benefits that we can call out to say, we're asking for this investment today, and the return is going to be this. And so, it might warrant actually some type of a little addendum to the report to call out some of the public benefit, not just individual people benefiting, but the whole community benefits when we reduce this problem.
I believe the recommendations at least touched on that, but I don't know the depth to which they got into it. So thank you for that suggestion. And I will admit, you think the humanity of the situation would be enough, but generally it's the economic argument that carries a lot of people.
Right.
So Fatima, then Lisa, then Mary.
I agree. I think the plan is great. The one thing that and I think most people have touched on this, is again the rental properties and the access to housing was one of my concerns.
Thank you very much. Lisa, Mary, and Meredith.
I think it's an ambitious and important plan. One thing that jumped out for me was, I think it was item number 6, reducing the amount of lead-containing products from retail locations in Minneapolis. I like the rental situation. I just find that to be almost an overwhelming thing. Like, and they allotted, I think, $10K for staff for 2 years, and then $2,000K annually thereafter. So to monitor retail locations in terms of pottery and toys and household items that are sold, again, I just don't know how that realistically is going to go down. How many targets are there within the city of Minneapolis? Just that, and again, you would hope that institutions, stores, owners of stores would do the right thing and not have, you know, a potential pottery device that's going to be used for someone's cooking at home. But in the end, I just don't know how realistic it is to attempt to do all of that. So that was just something that sort of jumped out at me. Not that we shouldn't try, but will we just be really disappointed when we're trying to go after every retail item in the city of Minneapolis not being sold, and then we have no control over when someone gets into their home how they use it, or you know. So anyway,
so we might be addressing that in later meetings. So
yeah.
All right, there was a little bit of reshuffling, but it's going to be Mary, Meredith, then Kozar. Now, Mary, you were having connection issues. So if you still are having connection issues, just kind of raise your hand or try to speak. And if you break up, we'll just let you know. Okay. Mary, we can't hear you, so we will circle back to you down the road if there's time and if you come back in. Okay. So it'll be Meredith, Kozar, Gretchen. You get to give a report, so you get to not do the plan. Then Laura. So Meredith, Kozar, Laura.
Yeah, I also thought this was a really robust plan in terms of just the funding strategies and the actionable items that were included. I particularly like the emphasis on the coordinated efforts across departments within the city. So knowing that, like at Hennepin County, we do some partnership between public health, like in my area, and family health with tracking blood lead levels. Also working with our environmental health folks at Hennepin County too. So it was nice to see that was really woven throughout the report in terms of working together cross-departmentally. I think it's a great idea to try to use those ARP funds to get as much accomplished in the next 2 years as possible in terms of addressing and identifying areas or homes or properties where there needs to be a focus on lead and eliminating childhood lead poisoning. So I thought that was a really it's great to see that funding is being used for this purpose. And I also just wonder about like sustainability of this, knowing that beyond those 2 years, what happens, because not everything can get done in those 2 years. And so, you know, you build up some momentum and hopefully create some infrastructure. And then, you know, the age old question is, well, what happens after the funding ends and how do we sustain this effort? So just trying to think about that. And then to the point made earlier around like, what's the, you know, return on investment, right? And in preventing lead poisoning. And I think there is some information out there that, I mean, it comes out mostly in educational costs, right? Because for children, this ends up being developmental delays and need for special ed services pretty much. Or a lot of it is bucketed into that, as well as medical and healthcare costs. So there might be information out there, and I don't know, I haven't looked for it in the plan, and maybe it's referenced here too, but that might be some interesting information to take a look at.
Thank you very much, Meredith. That was a good list. Two of the things I picked up on, one was before you were here. Two of the people who helped draft the recommendations, Angela and Paul, were very intent on making sure that other departments in the city were on board before they even wanted to present the plan. And I'm like the Don Quixote over here. I'm like, just write it. Let's just do it. We'll get it done. And they were more grounded, shall we say, and making sure that we had that buy-in. And then regarding sustainability of the program and that ROI, I think you're right. There will come, given the magnitude of the problem, we are going to need to keep justifying paying for this program. And so it could very well be a good investment of the committee's time to do that research now, knowing that those questions are going to come up in the future. Okay, now I got to stop talking after everybody, or we're never gonna get out of here. So it's going to be Kozar, then Laura, and Margaret. Did you want to weigh in, or do you want to skip this one? Okay, and then it'll be Terry Ann. So Kozar, Laura, and Terry Ann.
I guess what I'll say will kind of be echoing what others have already shared. I think the report has been able to really capture a very deep but very broad topic and just how like lead exposure affects our communities. But I think the piece that I like think of is for stakeholders and partners, what does it look like to partner with like public housing assistance service providers, right? Those folks who are doing the wraparound services, who are aware of our current existing housing stock. So working with the MPHA, making sure that we're partnering up with them to see, you know, folks who are on vouchers and those, you know, property owners, are they willing and are they open to participating in such a program, right? So maybe having communications really tailored toward them, and then also really being able to do a cost benefit analysis of why they should buy into this program, and then being able to provide direct incentives to get them to feel more encouraged, to really do an ecosystem snapshot of what the economic factors are. So like, I think people have been talking about like how this lead affects cognitive development, right? So any early on cognitive development challenges will ultimately result in an economy and people like, you know, folks who are working and a labor shortage, right? For a lot of the work that is happening, especially with a lot of jobs heading towards artificial intelligence and tech, how could young children, right, who have challenges with just cognitive development get into such fields that aren't really thinking of folks who might have certain challenges and issues, right? So, you know, I'm just thinking, what are the incentives? Who can we partner up with? Who are the right stakeholders? And maybe doing a stakeholder map. I only could briefly review the report that was created. It's very robust, but I think ultimately there does need to be some type of like cost benefit analysis and recommendation for economic incentives for folks to be able to participate, because they will then put that burden on renters.
There might also, and I just said I wasn't going to talk. There might also be some benefit to lifting up those people who don't necessarily need that economic incentive, but are doing the right thing anyway. Some people like to be recognized when they're doing the right thing, and sometimes that can be a really inexpensive incentive. Okay, Laura. Oh, sorry, go ahead.
No, I was agreeing with you. I said for sure.
Oh, thanks. Okay, it's going to be Laura, Terry Ann, and Wanda.
Well, I don't think I have anything unique after all of those good comments. I guess the only thing I would kind of, if you want to do another tick and tally, I too am really worried about the reimbursement model and the sustainability of that. You know, I think the initial report has, I think, good call to action about it that kind of gets maybe people interested right now. But I worry about the sustainability for all the reasons people listed. Passing on, really, are people going to take, you know, the initiative? We've got a vulnerable population living there, so they can't advocate, you know, in a way with any power to get things to happen. So how are we paying for this as a public good, you know, in a sustainable way, so that that these kiddos don't constantly like hang in the balance, you know, of people's interest? Just doesn't seem like a good plan long term.
Here. Okay, Terry Ann and Wanda.
Yeah, I concur with everything everybody has said already. The part that really stuck out with me was the access to information. And then my brain goes to, how do we empower vulnerable people to act on information? Do we have resources to give them legal help to file a rent escrow or to do something collectively in an apartment building that they've seen is on the list, so to speak? How do we advocate for resources to educate, whether it's in the schools or, early family childhood education, all these avenues to help parents really, like, a lot of times is when you have a kid is when you step up and go, oh my God, I got to pay attention to this stuff, right? How do we leverage that in all communities? And then say, not just enough that you know about it, here's some resources. And then the other part too, about recognizing people doing the right thing and having funds for landlords, even if it's in another state, to say, okay, we are going to fix this in this building. The other piece I'll just add from a economic point of view, I agree. Someone said, well, there's all this public good, but then it kind of boils down to what's it mean to me, right, as a landlord? Well, children with developmental issues often have a lot of behavioral issues, and they're very hard on their physical environments. Okay, I just tell you that as I know that as an occupational therapist, and I've worked in homes. And if I'm a landlord, why do I want to create an environment where I'm just feeding in to things that are going to not help kids, and is going to trash ultimately over years, potentially the place I'm trying to keep going. Now, I know there are slumlords who don't, give a crap about that, but at some level, there is a little argument about, hey, do you want a stable renter? Do you want parents who can go to work because their children are developmentally appropriate, and so that they can pay the rent? I mean, I think there's a lot of ways to spin that argument to make it like, what's in your self-interest, landlord, to take care of this. So I just see lots of multi-pronged approaches. I agree, the sustainability thing. I mean, for me, and I think of what can our committee do? How do we get our city council and, to leverage the resources coming into our city so that we can make resources available to people? I agree. I think taking in this a punitive, like, you can't have this in Minneapolis, you can't have that, that doesn't really help in the long run. There's no way we can police it. But education, and even to someone's point about what do they do with the stuff once it's in their house, that's another piece of it, right? Of educating in a lot of different ways for a lot of different communities, like, why this, not that in your house? What does it mean for your 2-year-old? So yeah, those are my thoughts.
Thank you. Excellent thoughts. I just took some notes on what I would have said if I were going to allow myself to speak, but we're going to move forward. Wanda.
So my apologies, I am actually on break from the district and have not been looking at my emails, and so I cannot give an informed opinion because I've not read the report.
No problem. Thank you, Wanda. Okay. Whew, those were some good notes. Thank you, everyone in the committee. I know Margaret was typing furiously, and likely will pass those thoughts on to Lisa. Next we have, I'm pulling up my agenda, I believe we have Gretchen's report. Okay, I'm seeing nods, that's good. Gretchen, how's it going?
Going all right. Thanks for asking. Just on a personal note, I was just told within the last hour or so that my son and his partner had a child, and it's a healthy boy. So I'm grandma.
Congratulations.
Yeah.
Do you have any pictures?
I do have one picture, but I don't know.
Maybe not ready for its public debut.
Congratulations, Grandma.
So, yeah.
Yes. Wonderful.
So great to listen to your conversation about the lead plan. In many ways, I think there's more for you to learn about what the city's already doing and has in terms of resources for some of the concerns that you have. And so I think it's great to hear your interests. It is really helpful to have a plan. And the reason for that is if you have something that then has been presented, adopted, or considered, or listened to by the council, when you come forward then with funding, they can relate it back. And so I guess one thing I wanted to talk about was the ARP funding, or I think that's what I'm calling it anyway. Some call it ARPA, and some call it ARP, but so that's the funding that has come to the city, and the city needs to decide how to spend it. And the way that the city is approaching it is to divide it into 2 chunks. an initial chunk, which was uh, allocated already. The city council agreed or modified what the mayor's recommendation was and voted on it in July, I believe, this month still. So that money is going to be immediately available and can be put to use. And then the remaining portion is going to be discussed and decided on in conjunction with the city's budget, which is a decision that's made at the end of the year. And I believe there will be some more public engagement that's a piece of that, but I really don't know what form that will take or what that is. I also know that the city has had a chance to look at its financial status in light of COVID and all the other things that have happened to businesses and others over the past couple of years, and using 2019 as a baseline, which was a very positive year where revenue exceeded expenses for the city. The last 2 years and next year are not expected to be years when the revenue exceeds expenses. And so I believe there are ways to spend ARP dollars that relieve municipalities and other governments of some financial burdens that occurred because of the pandemic. So I don't know. The mayor is expected to give a budget address for 2022 in August. And so not sure how that second lump of ARP dollars will be spent. But in the first lump, related to the health department received quite a number of areas where we received support with ARP dollars, violence prevention, food insecurity, and our lead plan. And so I wanted to just focus in on the specifics of that tonight. So already, even before ARP, we put together grant dollars and other payment mechanisms to post a position to coordinate, to work with regulatory services. So as they work with rental licensing and look at rental units, we will have a position, and it's posted right now, and we're starting the hiring process, so that they will be able to get trained and think about when they're in these places, they're looking at all their normal stuff, how can they become a little bit more attuned to lead and know what to do when they see something and turn it over to the lead team. So that is already in play, and that's one of the early recommendations. So in the ARP dollars, there are 5 positions. See if I can even read my notes. 2 lead and healthy homes inspectors are in that funding, as well as some environmental services inspectors and an administrative position that'll really help kind of drive some of these ideas forward. And there is some of that funding is available for remediation. So not the bulk of it by any means. So we're really setting up the staffing infrastructure between the regulatory services person and these new positions, so that we'll really be able to get out there and do many of the things that I heard comments about. Gee, how can you do this? Our hope is that in the second lump of ARP dollars, that there would be some additional support for the remediation efforts. If you're wondering what's next and what can you think about and what to watch for, that's one. We also know that in the we're looking forward to the mayor's address. We expect that he will also be talking about an asthma position we have asked for. You may have heard, I don't remember if you've had a legislative report, but over 7 years, we have been working on at the Minnesota legislature to try and get them to accept a use of Medicaid dollars that is sanctioned by the CDC and recognized as the best practice. And it's even in little pyramids of what people should do, to have good policy that supports public health. And that is to use Medicaid dollars to go into people's homes and do assessments of the home and bring in and to pay like our kind of staff. So it doesn't have to be like a nurse. It can be our kind of staff that would do an assessment of a home, and to also pay for some of the things that would help make that home healthier, like HEPA filters, mattress covers, all those kinds of things that have been shown to really assist families in keeping their kids out of emergency rooms and get them to go to school. And we've been parts of those studies. So that occurred over at the legislature. And in addition to that, we're looking for some general fund support for additional staffing. Just an example of how some of our work has already kind of started in play. We have already encountered a family that didn't qualify for some of the other income eligible programs that we have to help them with lead remediation in their homes. And they were just above that. There's certainly a family that has financial stresses. And so we were able to begin the process of helping them remediate lead in their homes. So just an example of how, a plan leads to lots of great new requests, and it's grounded, and it also drives action. So I hope that makes you feel some sense of hope.
That's wonderful.
It's a big problem.
Thank you. Wonderful.
Yes. I think any other questions about, I know you've had some other conversations about grants we've gotten. Not sure what exactly to expect out of the mayor's budget address because of that financial situation I just described for you. I think he will be supporting efforts to restore some of the cuts that were made during COVID to some of our staffing, sort of an incremental improvement. But we also had some great new ideas for him to fund, and not sure, what'll become of those. We'll have to wait and see. But yeah, any questions about budgety stuff? Otherwise, I'll talk a little bit about COVID. Yes, Margaret.
Gretchen, can you just remind people when the mayor will give his budget address? I'm not sure that you actually said when that happens.
It's in August, and I'm sorry, that's the best I can do. I'm sure there's a date already, but I don't remember. So then when it comes to COVID, we in the department have been right-sizing our emergency response. We had quite a structure to guide our response, and we have decided to basically deactivate that structure, but take the work that needs to be done and assign that into parts of the department. So we had a meeting today, pretty much bringing closure to that phase. So as we're doing that, we're also very aware of what the Delta variant is doing in the community. And today the CDC did announce some new recommendations. Recommendations for wearing masks for vaccinated and unvaccinated persons in indoor spaces that are public, and especially in areas where there is substantial or high rates of infection. Now, in Minneapolis, we're not there. We have moderate. So, but we are seeing an increase, and it's not inconceivable that we will get to substantial. And so we have begun conversations this week, and we'll have some more later this week about whether or not it makes sense to have a strong recommendation in Minneapolis, maybe stated by the mayor, maybe stated by the commissioner of health. Not sure who the spokesperson would be if we did such a thing. We started the week talking with the county as well about this issue, even before we'd heard about CDC's change in their recommendations. So it's definitely the Delta variant seems to be not only more transmissible amongst people that are not vaccinated, but there's some speculation anyway, maybe more than speculation, that those who are vaccinated who do get the Delta variant can spread it, which is why CDC has made a kind of a change in course of their recommendation from earlier recommendations about vaccinated people wearing masks.
I have a question. With Delta variant, I think I've been seeing and hearing that there's a shorter time span between encountering it and then having symptoms. Do you know about that, what that time range is between the encounter with the variant and starting to have symptoms? Because I think it's definitely less than 14 days. I think I heard it was like 3 or 5 days.
Yeah, I'm seeing Laura has an answer in that, because that's not something that made it onto my radar.
I think it's about 5 to 7. So
Okay.
you're right, Britt. It's a quicker time from kind of exposure to symptoms.
Almost silver lining, I think. I mean, yeah, there's so many more.
Yeah, you can do a little bit less damage. Yeah.
That 2-week time span was for like just regular COVID was just horrible, because it's like you have 14 days. You're like, do I have it? Do I not?
You could touch, yeah, you could impact a lot of people in that time frame.
Yeah, I mean, you can still impact a bunch of people in 5 to 7 days, but more than.
Thanks for finding a silver lining. Yeah.
I mean, if people start having symptoms, the hope is that they start staying home too, hopefully, if possible.
Yeah, there is just a much higher amount of virus in people's bodies when they are infected with Delta. And so that's the transmissibility is just really much more significant.
1,000 times higher amount of virus, I think I read, for being present in the body with the Delta variant.
I'm not sure what number it is, but it's a big one. Yeah. So I think those are the two things that Margaret pointed out that you're most curious about, but I'd be happy to talk about other things as well. We are gently moving back into our offices, likely to be working hybrid, settling into what our first version of our new normal, September 7th, for the city as a whole, but really taking a live and learn kind of an approach, so that we'll try things out and change and improve and modify. So.
Wonderful.
I imagine at some point that will impact the city's use of technology in terms of thinking about hybrid meetings, or not sure exactly. Margaret maybe has had some briefings on that from the city clerk. I don't know what approaches the city might take for meetings with public.
Yeah. Yeah. Thanks for asking for that. We actually, I think, have a meeting on Thursday to continue that conversation. The city clerk is actually taking some time to figure out how do we potentially offer some type of hybrid versus sort of mandating that there are in-person meetings again. And I know that they have sort of the IT people, kind of working furiously on that. And Hattie, you might know some more about that, but at this point, they are still doing, as you know, tonight, MS Teams meetings until they get sort of all of those pieces in place to be able to offer either some sort of hybrid or to set some sort of timeline for when we might return to in-person meetings. And I see Britt's hand up.
Yes, I do. So bringing this back to our priority survey, since air quality was mentioned, I'm wondering how, like, well, our Department of Public Health, but other city agencies and buildings within the city in general can promote a continuation of jobs that actually can absolutely be done remotely at home, and or just having more of a hybrid model versus having everybody coming back to their offices full time, considering the traffic, the parking, the congestion, all that. Because I'm starting to, because I haven't really stopped working in person at the hospital, and I'm starting to really notice more and more traffic, and it's also bad for mental health to sit in traffic. I've realized this again. So I'm just wondering how we can support and promote keeping people remote if their job allows them to do that remotely versus bringing them back into the office, or a hybrid model at least.
Yeah, I personally am hoping for hybrid, and that's a huge range. Hybrid is like a little bit of something or a lot of something, or everywhere in between. Because I think people, the cost of time and transportation is certainly worth a lot of consideration. It's also beneficial to be a part of an organization that you know their culture and you feel connected to it, and there are opportunities for innovation and spontaneity because of running into each other, or being able to say, hey, I just had this thought, and maybe you don't feel like calling someone on the phone. So for me as a leader, it's trying to balance those, but I'm not getting the sense, except for maybe people who have work at the service desk or something that's really place-based, that there will be work that I don't expect that there will be work in the city that is not at least hybrid.
In the chat, I saw a question asking about any conversation on mandating vaccinations, either at the city level or at the private employer level. Have you been hearing anything about that?
Oh, yes, I certainly have been hearing about it. And we're part of the Big City Health Coalition. And so they have been surveying members, big cities across the country, about both mask mandates, encouraging mask wearing, and vaccine mandates. And I think New York might be the only specific one I've heard of. That's certainly healthcare settings seem to be moving somewhat in that direction. And there was a big letter that was signed by many, many different healthcare organizations in support of the need to have workers vaccinated, that was just published in the last day or two. So yeah, I think one thing that's a bit of a speed bump for people that are thinking about that is that we still have only provisional approval for the use of the vaccine. And so I'm imagining that when we get to full approval, that company lawyers and all sorts of other folks will feel that it's a better environment to proceed with requiring that.
I know that the military, as of September 1st, is going to be mandating it. And I saw today that, I'm not sure what the schedule is, if it's going to be in sync with military members or before or after, but the VA healthcare system is going to be mandating it.
Yep.
Okay, let's not forget to use our hands.
I use my hands when I talk.
Okay. Did you get out everything you were saying, Gretchen?
No, only to answer questions.
Okay. Okay. Thank you very much. Okay. Were there any other questions relating to lead or the variants or vaccines? Okay. Seeing none, I say we let. Oh, go ahead, Margaret.
I was just thinking that, you know, Laura, I know you're in healthcare, and Gretchen had made the comment about healthcare potentially moving in that direction of requiring vaccines. And I was just wondering if there were other committee members who had information from the places that they work, you know, as to whether there's any indication, you know, as to a requirement for vaccines or, yeah, or sharing from your personal experience.
Yeah, I can share. So for Alina Health, we are definitely moving towards mandatory for flu vaccine this year. And I think a lot of folks feel like that is somewhat of a precursor, but I think Gretchen is spot on that until there's formal FDA approval and it's not emergency use, I don't foresee us moving to a mandate. But we are having patients ask us questions. And so it's hard to be a healthcare organization and not have team members that, you know, are vaccinated caring for you. So I think it's a compelling argument to say that that's the direction we'll probably move, but we do not have any formal mandate at this time for COVID. But we will for flu this year, and that's a first for us.
Okay. I saw Craig unmute. So Craig and then Britt. And then was someone trying to talk? Okay.
Yeah. So this is Craig. So the University of Minnesota is not mandating vaccines. It's been a hotly debated topic around the School of Public Health. But you know, Mike Osterholm in particular feels that right now around the university community, we have a pretty high level of vaccination acceptance. And Mike's feeling is that mandating the vaccine across the university is just going to further polarize people's opinions. And it's not going to be what we need to compel the fence sitters from moving towards vaccine. But, you know, that could all change over the next few weeks or months as well.
Thank you, Craig. Britt, and then a quick reminder that the things that are being typed in the chat will have to be read aloud.
So I'll read the chat really quick, but Beth asked, is there any insight into when FDA will give standard approval for vaccines? I responded, I heard late August, considering military is going to mandate by early September. Meredith also said, I heard August/September. I replied, but that's just hearsay so far. No confirmation that I know. That is the chat. And for HCMC with the flu vaccine, it's always been, we wear a tag when we have the vaccine, and those who choose not to get the flu vaccine for whatever reason, and this is pre-COVID, during the active flu season, they would have to wear a mask during all patient contact. We have not heard anything about anybody being any organizational mandate for the vaccine. I believe that our organization is around 80% vaccinated though. So I hope that we have the other 20% joining us sometime soon.
Has anyone heard whether or not school systems will be mandating vaccines once the vaccine is approved?
Just recommendation, no mandate.
Well, measles is a mandate, so I don't know if there's been any scuttlebutt.
COVID's right now is not, we haven't heard that it's mandated, it's still voluntary. And of course, it's not available for children under the age of 12.
Thank you, Wanda. I will say I do work remotely for an organization that's statewide, and none of my greater Minnesota organizations have been talking about mandating vaccines.
No, anecdotally within our region that we serve, within our sites at Alina, there's a huge difference between our metro sites and our regional sites in terms of the percent of our staff that are vaccinated. Mm-hmm. It's kind of night and day, so.
Okay, the only hands I'm seeing are from Craig and Britt, and I think those might have just been left over. Great question, Margaret. Nice job. I hadn't thought to ask the committee about vaccines. Were there any other questions you wanted to ask the committee? Or did anyone want to bring up? Otherwise, I am in favor of letting our new grandmother go and maybe FaceTime for the first thing. Baby's first FaceTime. Okay, seeing no objection, thank you all for the excellent conversation today. I look forward to diving into the survey results. Next month, I would expect us all to dive into them together and to start taking some actions. Have a wonderful evening. Meeting adjourned.
Thank you.
Absolutely. Thank you.